Some structures
Take
what
some
is
good
possible
pictures.
to mark
Take some good
during
video.
the competition. Okay, so the last time I removed this brain, some of you see how we removed this brain from the cadavers. It's a fresh one. Okay, so we concentrate from the what? The maybe the artery, the vascular system. Okay, because you have some pins. When I use this brain, I marked you one artery from this specimen, one nerve, and one extra structures from maybe the dura mater or the spinal cord. The firstly, we concentrate from the vascular system. Yes. So for your list, you have the intercranial part of vertebral artery. So I think if I marked like this, and you call me this structure vertebral artery, I give you the point. Yes, because here we have only the intercranial aspect in the part, so the fourth part. And now we concentrate from the artery. Oh, here is the damage, but now like this. The artery originates from a vertebral artery. Here you find the anterior, you see, spinal arteries, but it's not for your list. For you, it's very important, okay? And here you have the artery supply the cerebellum. Normally originate from lateral aspect of vertebral artery, like this, goes here around. What is this? Around from which? This is a tonsil, exactly. Supply the posterior aspect of the cerebellum. It's called posterior inferior cerebral artery. Okay, so this region always originate from which artery? Always originate from the vertebral artery. Here from this side is not visible. From this side, yes, is visible. And here, where we cross the inferior aspect of the pons, here you have the place where these two arteries join and form one unpaired artery is called basilar artery. And the basilar artery gives off two arteries supply cerebellum. The first one is visible here and is called the anterior inferior cerebellar artery. This is it here, so I mark like this. Around this same here you have the veins. Yes, this is a vein, but we do not mark you the vein. The artery is the main important here. And finally here you find which artery? Superior cerebellar artery. Yes, so we have a two. Why this artery is called posterior, this anterior? Because if you look here, change a position and separate these by a medulla oblongata from this region. Here all of these arteries supply the anterior aspect. This artery around the yes, here tonsil goes posteriorly and supply posterior aspect of the cerebellum. So here you find superior cerebellar artery. Here is for you, is very important during the competition, which artery? Choroid, but the posterior. Yes, this is the posterior choroidal artery. And the last one, artery originate from a basilar artery, is which artery? Posterior cerebral artery. Okay, so now you see the posterior cerebral artery. This is what we see here. So exactly from this specimen you find here the posterior cerebral artery here is visible, and this one is superior cerebellar artery. Between these two arteries we localize it what? The oculomotor nerve. So here is visible oculomotor nerve, this one. Yes, here this is the oculomotor nerve between these two arteries. And now we are from the around optic tract. So here where we have the optic chiasm, from the level of optic chiasm you find which artery? Internal carotid artery, exactly. And the internal carotid artery here gives off the posterior communicating cerebral artery. So this is this artery, the first one, more medially. Okay, so this is the communicating, posterior communicating And you remember these are paired arteries from the left and right side. The next one here, this artery originates from a middle cerebral artery. So the middle cerebral artery is here visible. It's not included to the circle of Willis, yes, but gives of very important arteries. This artery, which artery now you see? Anterior choroid artery, exactly, yes. So this is the anterior choroid artery. This is it. Supply what? The choroid plexus of which ventricle? You know, lateral ventricle, yes, and some branches of the third ventricle. This is this position. This posterior choroidal artery supply the fourth and the third ventricles. So it's very important arteries, okay?
Anterior choroid is not involved too in villi circle.
No, only this one, yes? So only medialis branches. So the posterior cerebral artery, posterior communicating cerebral artery, and here when we look like this, maybe I open this one, is a anterior cerebral artery. So here is, I marked you, yes. This one is a subcallosal position here, you see. So if we have a specimen, you must know, during your practical test, you must remember and you recognize only the name artery. But normal, during the clinical implication, this artery has a part, like a subcallosal, pericallosal, postcallosal parts, yes? So here, I marked you the subcallosal here from this region. This is visible here, anterior cerebral artery. And from the middle position, exactly here, I see it, this one, and I show you, here you have one unpaired arteries forms the circle of Willis. It's called anterior communicating, yes. So this one, anterior communicating cerebral arteries, is visible here. Sorry.